UNAIDS calls for urgent action on rising HIV rates among Caribbean youth. The joint United Nations program on HIV/AIDS UNAIDS has expressed serious concern over the increasing proportion of new HIV infections among young people in the Caribbean, urging further investigation and targeted intervention. According to UNAIDS, the percentage of new HIV cases among youth ranges from 14% in Suriname and Guyana to as high as 37% in Barbados. Dr. Richard A. Menya, UNAIDS multi-country director for Belize, Barbados, Guyana, Jamaica, Suriname, Trinidad and Tobago, and the Organization of Eastern Caribbean States, OECS, highlighted the alarming trend. HIV among young people remains a significant public health concern, as the decline in new infections among adolescents and youth has not been rapid enough to effectively control the epidemic, Dr. Amenya said. Globally, young people aged 15 to 24 years accounted for 28% of new HIV infections in 2023. In the Caribbean, young people comprised 27% of the region's 15,000 new infections in 2023, up from 15% in 2020. Dr. Amenya emphasized that these statistics threaten global efforts to end AIDS as a public health threat by 2030. The situation for children and adolescents is equally concerning. As of 2023, 2.38 million children and adolescents aged 0 to 19 years were living with HIV worldwide. Of the 630,000 people who died from AIDS-related illnesses last year, 90,000, 14%, were children and youth under the age of 20. While new HIV infections among children aged 0 to 14 and adolescents aged 15 to 19 have declined since 2000, progress has stalled in recent years. A particularly vulnerable group is adolescent girls aged 15 to 24, who accounted for 71% of new infections among adolescents in 2023. In regions such as East Asia, the Pacific, Latin America, and the Caribbean, 2/3 of new infections among adolescents, ages 10 to 19, were among boys. Additionally, 25% of all pregnant women living with HIV globally are between the ages of 15 and 24. Dr. Amenya called for a renewed focus on early diagnosis, treatment, and prevention efforts to address the growing disparity in HIV infections among young people. If we are to achieve the goal of ending AIDS as a public health threat by 2030, immediate and sustained efforts must be made to address the needs of young people in the Caribbean and globally.